Good afternoon. Thank you so much for coming for our second Pecha, and I'm trying to learn how to say this properly. I've seen some of the slides ahead of time. You're going to love it. I can't wait to hear the words that everyone has to go along with the slides. I'm Lucy Dabney. For those of you who don't know me, I'm the Executive Director of Program to Aid Citizen Enterprise. And this sharing came out of just what went on with our groups in the Intensive Services Program. One year someone said, you know, it would be a great idea if you brought all of us together and let us see what the others are doing. We might be able to help one another. And so we thought, what a great idea. So we did that for a couple of years. And then we came across this way of presenting this Pecha and said, what if we combine those two? So for those of you who have never seen this before, you're in for a treat. For those of you that have been here before, you know how much fun it is. And so it's going to go really fast. There aren't going to be any introductions in between. And literally, as soon as I quit talking, you'll get an opportunity to see what's going on. And please stay afterwards and meet some of the groups, meet other people. It's a great opportunity for you to find out more about what each other does. I think most of the group people in our program know one of our goals is that you all collaborate together, get to know one another. So without further ado, welcome to Pecha.
Come on, we don't have time. Good afternoon. My name is Yinka Aganga Williams, and I am the servant of Ajapo, and here is one of my assistants, Ariel Saboham.
Hello.
Hi. Pecha Kucha.
So we are here for Pecha Kucha. I don't know how to pronounce it, so I'm sorry. Ajapo stands for Acculturation for Justice, Access, and Peace Outreach. Our mission is to serve refugees and immigrants in the Pittsburgh area in Allegheny County. We serve families and communities of hope as well. Our mission, I'll just start and then you follow. Okay, our mission is to help refugees and immigrants to become self-sufficient in the Pittsburgh area through a continuum of care. And Ajapo is now a refugee resettlement agency. We have been around for about more than 10 years now, and we serve about 300 countries a year. And the refugees, the communities we serve, the refugees and immigrants, come from these countries that are listed, just to name a few. All right, 90% of our refugees and immigrants are from families and individuals who come to the United States through the federal government, and then 10% are just other people who come on their own. In these pictures, you can see the life of refugees and immigrants who come here in the United States before they come. This is how they live. And like these pictures represent the way they live, and you can see that they're not sanitarily healthy, their ways of life. All right, we are their first point of contact. We want to ease their transmission process, and by doing that, we kind of are the first people they meet at the airport. And now I'm going to leave it to Dr. Williams to present the rest of the presentation.
Why are they here? 3 things to make sure that they can find life back again. Liberty, pursuit of happiness, which I know that apparently the founding fathers of America got right from the beginning. So everyone seeks after it. If you find immigrants on the street, just talk about those 3 things and they will agree with you. These are the work that we have to do with them for the first 90 days after their arrival. And I'm not going to go through that, as I know everybody can read, but you've got to find them housing before they arrive. Make sure they have food, clothing. Get them all their necessary IDs. Since they were here through the federal government, it means they're entitled to all that. After their 90 days, this is the work we do with them for the following 5 years to make sure that really they find their feet on the ground and well-groomed, ready to go in the United States and live the American dream. The outcome of that work that you just saw is this. Children go to school, graduate from high school, move on to college, move on to vocational institutions, do things that are beneficial to them in life, and be able to live the American dream. The adults do the same thing, except that it goes into work, and sometimes for those who do not have GED, especially as many of them do not have even up to elementary school education, we do everything to make sure that they get some education and be able to work. They live the American dream, but at the same time, they still remember the cultures of origin, of where they come from. And we do have quite a number who give back through community service. They volunteer, they share their talents with others, they share their culture. They lend helping hands wherever they can. PACE capacity building, I think quickly, I'm just going to talk about it. These are some of the things it has done for us, but I just want to talk about the last item that you have there, which has to do with the 990s. We have filed ours up to 2012, and from what I hear, a lot of nonprofits are still far more behind. So thank you, PACE, for getting us there. Last year, we got a grant from Macaulay Ministries, and we started off micro-enterprise development with some of our refugees, and that was by their own asking. It's not something that we decided to do, but we had a focus group discussion at which they said it's one of the things they want to do. The skills that we're training on at the moment is sewing, and you can see some of the participants here, as you did in the other photos. They did training, and they've just started production this January. I guess the next slides will show us some of their products. As you can see, the main thing that we use, the main products that, main fabric that we use there is just the African fabric. So we do not use any other fabric other than the African fabric to get this, and that is where the niche of what we're doing is. Thank you very much.
Before the first slide comes up, I'm Leon Haley, and I'm pitch hitting for our executive director, Kevin Carter, and also for our board chairman, Matt Lancaster, whose father died, and so neither one of them could be here. And so I want to make this presentation on behalf of the Adonai Center. Now, the word Adonai, as I understand from Kevin, is a Hebrew word that refers to something like a gathering of sorts. And so one of the things that we do and stress in the center is that young men have a choice to make, and it's their choice. It's not your father, and it's not your mother, and it's not your brother, it's your choice. And so we suggest that parents, and good parents, kids will lead by example, or parents will lead by example. Now, a grouping of our students, this is a picture of a group of the students we work with. You can see handsome and dressed in white shirts and red ties. They were at the Stowe Rocks High School, which is one of our sites. And this is a picture taken of a presentation. This is the sort of background of the Adonai Center, which was initially known as the Adonai Restoration Center, and was serving both females and families. And then we switched in 2011 to focus exclusively on serving black males, and became known as the Adonai Center for Black Males. We sort of, one of the things we stress is having a vision. And so over the last 3 years, we've been involved in some major accomplishments. And I'm not going to read them all to you, but one that is not there that we think very highly of is the development of what we call the standards of mastery. You will hear a lot of this, hopefully, in the future. And I'll talk briefly about it as we go through. The impact of the program over the past 3 years is our target population, as you can see, are black males. We serve 369, and those are largely participants in the program as well as those who attend a conference, which I'll be talking about in a few minutes. Now, this is the core of our program, and that is providing core basic knowledge and skills that young black men need in order to become productive in American society, and what we say, increase their human capital value. And so what we do is the standards of mastery are knowledge and skill based, and the students are exposed to those through coaches. In addition to the core program of working with men in high schools, on site-based high schools, we have what is called the Next Generation Project, which we're trying to build on to serve those who graduate from the program but still need assistance, still need support, and we call that the Next Generation grouping. One of the major program offerings and events held by the center is the Young Men's Conference, which is sponsored by a number of Pittsburgh-based corporations. What we try to do, bring young men together and to be sort of informed and interact with black leaders, and both men and women, addressing some of the issues in their lives, in their communities, trying to get them to interact and sort of begin to see that there are models out there that they can follow and emulate. And so this interaction goes on during the conference. By the way, the third conference is going to be May 29th. Quickly. This slide was Kevin's idea. What we really wanted to say is that Pittsburgh is a great place, and we feel that in the center has a role to play as a nonprofit, as well as other organizations. What we need to do is work together. That's a picture of Kevin Carter, our founder and director. He's really a charismatic young man, really gifted, and really committed to helping young African American men. And Matt Lancaster is our chairman of the board. I won't say anything more about that. You can read the board of directors. I asked Kevin why you put this up there. He said they told me to be funny. I was really originally going to X that one out. But anyway, I said, that's what he wants. That's what he wants. Prior to, anyway, he said he was a little crazy until he got involved with PACE and some help. He called what he called these governance responsibilities were driving him crazy. In any event, he says, we need to support, in order to support black African American men, young black men, it takes many hands, and you can read all of our hands to work together to make a difference in their lives. Okay. Alrighty. And one of the things that has been very beneficial has been the PACE support for our board development. And Michael Coomer, maybe some of you know who he is, a great guru. He's excellent when it comes to board development. And so he conducted a board development session, 3 sessions, I think, for the Adonai board, and it was tremendous. And I was a participant, and I was an observer, and I taught board development at the University of Pittsburgh, so I watched Michael. He is good. In any event, what he helped us do was organize a stronger board, helped us with reorganizing the bylaws, and training board members in governance, and also looking at some of the issues we need to face in the future. Well, as a result of PACE assistance, we think, and I'm convinced that we're better informed, and what I like most importantly, a more engaged board than there was before. And that's something I think all nonprofits need, is a fully engaged and a board that's committed to its organization. So we are convinced that we now have a cohesive board of directors working very hard to try to accomplish the mission of the Adonai Center. And so what we suggest is, if you really want to bet, put your chips on us to get the job done. And last, by the end of our program, we hope we have recruited 5 new board members. Anybody here is interested in joining with us in this great effort, we welcome your interest and your participation. I think that's the last one. I think. It's changed since I watched it. Okay, so thank you, PACE, for helping us for black men, and that's some of our young men. Okay? What's that?
I did not know that we could put words on our slides. Sloppy cards. Okay, well, I'm Anna Hollis with Amachi Pittsburgh, and we support children of incarcerated parents. Who knows what God has brought us through this child? This is the English translation of the Nigerian Igbo word Amachi, and it forms the centerpiece of our mission, which is to empower young minds to overcome the challenges of parental incarceration. Who knew that a child grappling with parental incarceration would become Miss America, an Olympian, national recording artist, famous folks that we know and didn't know struggled with incarceration as a child. And then finally our founder, Reverend Wilson Good, who grew up with a father incarcerated and who knew he would later become the first Black mayor of Philadelphia, who knew he would later in his senior years develop this very mentoring model that has been evidence-based and nationally recognized, was picked up by the White House Office of Faith and Community-Based Initiatives, allowing hundreds of organizations across the U.S. to become engaged with children who, prior to this funding through the feds, had not been really noticed. So I'm going to be all over the place because I don't have words on my slide. So the essence of the Amachi model is rooted in faith, family, and community. We partner with churches and community groups, fraternity sororities, and this is where we recruit our volunteers to serve our children and families. Mm-hmm. And as you can see, Amachi brings out the kid and our mentors. Nancy knows that, except that she doesn't stick her tongue out at freebie, right? So our volunteers from our churches really help us to provide, critical support to our kids and families. We do one-on-one mentoring. That's our primary service, and that's most appropriate for kids who have a parent that's away in a state or federal facility serving a long-term sentence. We also do family reunification support for children who have a parent in the county jail whose parent's going to be returning home within a year or so. So we want to help the child and family kind of reestablish that bond. And then the final program is most exciting for me, and it's our advocacy program called Amachi Ambassadors, where we're actually develop the very young people we serve with leadership skills and giving them opportunities to raise their voice about what this cause is about, why they are important, why they should be recognized and noticed and supported. So what brought Amachi to PACE is that we went through a series of organizational and financial changes. That wonderful federal program that I just told you about was wiped out, so that impacted our budget 75%. And there we were having to regain our footing. It was really important for us to stabilize, to regroup and rebuild, and that's when we reached out to PACE so that we could really flesh out our sustainability plan. We knew that we could no longer rely on federal funding, so PACE has been very instrumental in helping us further develop that plan, to work on some of the foundation work that we need to roll out the plan, and to really do another critical thing, which was to convert our website to a CMS system, which allows us to control the content and send out constant updates rather than having to pay to have that work done. So that was a huge savings for us. Because of the organizational changes that we endured, we had a completely different, all of the staff members that were with us at the time of the federal funding cuts moved on to better opportunities. Look at those sweet babies, so precious. That's why I do this work and keep it going every day. But the staff members, moved on. No one knew whether Amachi would live or die. I knew we would live, and I knew we would rebuild, and it's because of the support of our advisory board members that came on board. I had to snag up a couple of our mentors and say, hey, I need you to serve in a different role now, and that's why Nancy is here with us today, new staff members, Emily Morris, and so we have a strong team, and every day we're getting stronger, and I can't express the magnitude of support we've received from partners in the community. This is, occasionally we get a little support from a celebrity. This bottom one photo is Chef Jeff Henderson, who was incarcerated for 10 years, had a 5-year-old son when he went in, son was 15 when he came out, and he cleaned up his life, became a world-renowned chef, and is doing motivational speaking, came here and did an event for us. So this sustainability plan that PACE is helping us to flesh out will enable us to produce more of these kinds of events that will help us raise funds Chef Jeff was phenomenal. He spoke with parents at the county jail. You see the kids in the top picture praying. And then he did a cooking demonstration with some of the teens in our program. So that was a really very special moment. He worked very closely with them, and you can see he was very hands-on. And so we hope to be able to do more of these events. We hope to continue, and we'll be able to continue working with our teens, our young people, to give them opportunities to speak in public settings, before city council, to express from their own voice what this experience is like, why it's important that we rally together as a community, why we no longer ignore how policies and systems are affecting them. Policies and laws are made to regulate incarcerated individuals, but with little regard for how those policies are going to impact the children. So now these children have grown up. We've been around for 10 years now. They're old enough now to say, this is how I feel about this, and we need to make some changes. And our voices are being heard. So I started off with who knows what God has brought us to this child. I'm going to finish with that same point. This is the epitome of what Amachi Pittsburgh is about. Caleb Boyer, who started as a young high schooler, being mentored for several years, went on to college to graduate, and is now on staff with Amachi.
Please don't tell my church that I can stand behind a desk for 6 minutes and finish and do a speech. So Senator Cares has been around for 13 years. Senator Cares is the acronym for Children/Adult Recreational Educational Services. However, CARES is much more than an acronym. It represents the foundation in which children, youth, and young adults can build their lives and grow. Like we said before, we've been around for 13 years, and this is a picture of one of our earliest students, Javon, my son, and Julian, and some others have gone on. Julian's now 22 or 23 and working, so we've been around the block for a minute. We average 100 kids a day, another 100 plus for the summer, and then another 100 plus during the Summer Basketball League. We try to grow boys, especially into men, and the uniqueness about us is that our original staff of men, Reverend Walls, Fred, Eric, and myself have been with CARES from its inception. We don't get paid a lot of money, but we're committed to the work and to the cause. We do come in, we follow what we call the 5 R's, come in, 2:45, 3:15, we relax, unwind, snack, reflect, repeat, homework, and so forth, read, reflect on a social issue sometimes, and recess, and all our kids to kind of just learn to grow and be exposed to each other. We separate our groups according to gender and age, and they love to play and have a good time and just develop relationships and fellowships along the way. And so we're proud of what we bring. We use our youth counselors as part of our staff to help out. We enjoy celebrities who come by, Brendel and Jake Weekly, and a younger picture of Dan Alvarado, and just at events with our children. We're so proud that, and Valerie and others, that how we continue this relationship over the years with wonderful people. We're glad to partner with twice a month with Reading is Fundamental. If our kids, the bus comes outside, the kids go on, they get books, they read to them, they talk to them, they get to carry home books. And so we stress reading because we want to make them as Pittsburgh Comics ready as possible. And so we're honored that that's just one of our many partners in this process. We also try to, twice a year, get that 40-plus foot pit technology kind of science mobile that comes, and they do experiments and exposure and learn and grow. We try to kind of prick their hearts and minds and imaginations that they might continue to strive for excellence. We want to make all our kids, like I said, Pittsburgh Promise ready. We have the strongest collaborative we have probably with our Duquesne students who come do their work study at Senator Cares. So we pick up about sometimes 6 to 24 kids who are counselors and work with our kids. Many of them come back every year until they graduate from their freshman year. The kids get on their laps, they play with their hair, they have a great time, they learn. This is an example of one of our, I believe, African American history bowls, and kids who get trophies. We try to salute our kids and encourage them to just strive for excellence. We have students who have 4.0, 4.1, kids who've won awards done. So we have our traditional Halloween costume fellowship. We also not only have our building that the Center Cares, but we purchased a building, a house around the corner with a garden and activities called the Cares House, really now for our middle school students, but we have a lot of activities there also. This is an example of what it's like at Cares, and that was the best picture of Reverend, who was just having a good time. They rest on the ground. They come clean, but they go home real dirty, but the parents know that speaks to volume to kind of who we are, what we do. They just simply love the experience and coming every day. We're blessed through Macaulay Ministries to really expose our children to our own, sometimes many college tours every spring, and every break we can get. They went to Howard, to A&T, Johnson C. Smith, Morehouse, Bennett, Winston-Salem State University, Livingstone College. We've been north, south, east, and west. I think here we're in D.C. with our kids, and continue exposure to make them to be all that they can. Many kids have never left home, never stayed at a motel, 4-star, 5-star hotels. They're like, oh my God. So kids said, do I make up my bed? I said, no. You don't have to make up your bed. We try to go to restaurants where they can open a menu and order. Locally, we try to really internally support, all the local tickets for kids and all the other trips we take internally. We have a young man who part of our program, Gene, who was in Greece at his local school, Malaysia, who was at Kappa. We supported her. We have kids who are in other programs. We, like I said, our kids are real. 100+ kids. I just think one summer they play the instruments. They bring, they play. They grow. We just continue to have happy kids. A Safe Haven is a free program every day from 2:30 to 6:30. We pick them up, we feed them, we clothe them, we take them home, tell them to pull their pants up, and everything else. The summer part, we have our traditional summer program, Basketball League, which is something else that Mr. Fred continues to be proud of. One of our basketball players was, help me out, who plays basketball now for DeJuan Blair, that's part of our team, so he got to start right here. So not only do our kids play basketball, but they also go on into service, armed forces, reserves. Devonna is one of our first students, and now not only she go through CARES and finish at CARES and graduate from CARES, got her bachelor's degree, her master's degree. Now she left CARES, and now she's a director for our school program. So we produce directors and leaders, and we're excited about that. So those are some of our kids. This is one of our Macaulay trips where we took kids to Jamaica and exposed them. We stayed at homes. They're supposed to be speaking, but the volume's not up. But Jamaica, so we lived in the homes of the residents in that area. We did a service project. And again, this is our next step future because of the PACE grant. We're able to hire a consultant who will help us with the sustainability of the future site. We purchased on my son's anniversary death the Ozenham Cultural Center. The new look of the building, a roof is getting ready to go on, renovations taking place.
Good morning. My name is Dr. William Simmons. I'm the president of Gateway Medical Society. Gateway Medical Society is an organization that raises a voice for physicians, nurses, dentists of color, and basically any physician that cares for the people who are socially, economically challenged in the community. Our main goal is to increase the number of physicians in Western Pennsylvania, but as you can see, 3.8% of the total population of physicians are African American, so they're really small numbers to begin with. So increasing those numbers isn't something that we can do just by trying to get more doctors. We have to go back further on the pipeline than that. And that is because right now we have a problem where even though we are 12.7% of the population in the U.S., only about 11% of our young people actually go on to college. So that's one thing that we're trying to address. And the ones that do go to college, only about 7% of those take the STEM programs, which leads them on to those kinds of courses. And another problem, because we're focused on African American males, as you can see here, the ones that go on to the bachelor's, the master's, and doctors are mostly the black women. The black men seems to be really deficient in that, and so we're trying to cultivate a group of students that are going to be absolutely ready to take their role in the future in the science, technology, engineering, and math. And one of the things is that if you can see the different groups as they people who are involved in STEM jobs, African Americans, if you were to be able to get one to take those kinds of jobs, they can have a major impact on their families by significantly increasing their family's financial potential. But right now, most of those jobs are done by whites. Asians, who are only 5% of the population, are in the second group. Hispanics are coming up, but we are flat and actually going down in the number of our kids that are involved. Unfortunately, right now, because we are trying to lend a hand to the next generation of doctors at Howard University, just last week, I was told that we are at a 32-year low on the number of African American males that are actually getting involved in medicine. That's back in the 70s and 80s. And so we have to do something about trying to increase those numbers. And we go back further on the pipeline, we see that our problem is that right in western Pennsylvania, 58%, that we only have 58% of our African American males that are actually graduating from high school, as opposed to 85% of the white males that are doing that. So our goal as a group is to try to, our mission is to educate, and so we're trying to educate some of our young people so that they can indeed be ready. As a part of educating the community, we're also trying to educate a group of kids starting at the 6th grade level. We have a program which is trying to help educate and get them ready. And why do we need to do that? Is because if you look at all of the major statistics, prostate cancer, colon cancer, diabetes, HIV, African Americans are the ones that are dying mostly of all the races from those kinds of things. If you also, and there are other things like heart disease, again, African Americans, cancer, African Americans. Now this is very unusual. The incidence, white females have the highest incidence of breast cancer, but black females are the highest death rate. That is a disparity that we need to address, and it's because when they're not giving the access that they need so that they can get the care. We do educate people by having several conferences. We have a community symposium, June 1st, Saturday, June 1st. You're all welcome at the Haberman Center, Shadyside Hospital. We also have a disparities conference, which is new, and that's at the end of October. Our goal is to plant the seeds into the lives of the families and of these young people so that they can see the value of getting a good education and being ready to take on the science, the technology, the engineering, the math, so that they can get those kinds of jobs. We also have a provider symposium. There, we try to educate the doctors and the nurses and other medical as to the changes that are going on with the Affordable Care Act and how that impacts them and their patients. And so right now, we're having a conference that's going to be combining Allegheny County Medical Society and Gateway together to cover those issues. The reason that we do that is that in the Provider Symposium, everybody has kind of a view. They have a piece of the puzzle, so to speak. But when we gather together, we get a bigger view of the problems that are going on in our community, and we can know how to address them even better. Now, this is a picture of our academic mentorship program. We start with kids in the 6th grade level, and every year we give them bigger and bigger challenges. Right now, we've been doing this for 4 years, so we have 6th, 7th, 8th, and 9th graders. Our goal is to go from 6th to 12th grade so that by the time they're ready to graduate, they'll be ready to go to college and take their places. We also contribute by mentoring and being with the medical students, and we give them scholarships and also leadership at the University of Pittsburgh Medical School. The other thing that we try to do, for one, we honor doctors that are in the community with our gala. We have a Physician Awards Gala, and this year, this is our 50th anniversary, and we will be able to talk about some of the physicians that you may remember from the past and honor them and as we recognize people who have traveled. Now, the reason that we are here today is because PACE has helped us to restructure our image. They have helped us with our website so that we can reach more people and give out more information, branding of Gateway Medical Society, some Facebook. We're also having we have access to the board work so that we can have and build a better board to help us in the community. And we're establishing a database so we can track our students, track the activities, the seminars that we do, so that we can better position ourselves so that we can take our place.
I'm Rachel Cohen with Heritage Community Initiatives. In 1983, Heritage Health Foundation was created to serve as the endowment arm of Braddock General Hospital, which became Braddock Medical Center, and in '96 became UPMC Braddock. UPMC didn't really need us as the endowment arm, so we became a freestanding, community-based nonprofit organization. While our organization still supported the work of the hospital, it expanded the scope of its work to direct service in the community. We serve the 37 communities of the Mon Valley through core programs in education, transportation, and community engagement. So in 2009, we changed our name to Heritage Community Initiatives. We operate within the Mon Valley. This is an area that was the economic engine that drove the Pittsburgh economy. However, over the past 3 decades, the valley's industrial base was virtually decimated with the closing of major manufacturing plants. Thousands of jobs were lost, and the families who remain in the area continue to face many obstacles. Our 4 Kids Early Learning Center has provided care for more than 3,500 children and their families in the Mon Valley since we opened in 1998. The center is accredited for the National Association for the Education of Young Children and has received Star 4 level from Keystone Stars. 4 Kids currently has 110 children enrolled from the ages of 6 weeks through pre-K. The curriculum at the center helps children to overcome barriers faced by low-income families, and the classroom environment is designed to promote successful learning as well as safety, comfort, and stimulation. From 4 Kids, our newest program is our Heritage for Parents program, created to provide parents with skills and resources necessary to support their children's future. 4 Parents offers workshops about issues relevant to parenting their young children, as well as one-on-one support for individualized needs. Our next program is the Heritage Out of School Time, or HOST program, providing before and after school care, as well as summer camp to students in grades K through 8 in the Woodland Hills School District. HOST began operating 2 years ago and has already acquired Star 4 status from Keystone Stars. HOST currently enrolls 55 children and provides these students with an afternoon snack, guided homework help, and age-appropriate enrichment activities to supplement the child's education. HOST partners with groups such as Winchester Thurston, the Braddock Youth Project, and local organizations such as the Center for Creative Reuse. Now, from education, we have a transportation program. Our Heritage WorkLink helps riders get to jobs, job training, and work-related support services. We provide a fixed route van service in the Mon Valley and connect our riders to bus routes from Port Authority of Allegheny County, as well as CCAC South Campus and Jefferson Regional Hospital. WorkLink has more than 3,000 registered riders, and due to Port Authority transit cuts, we provide about 13,000 rides each month. Without WorkLink, about 90% of our riders would have no other means of transportation to work. Our community engagement program was designed with 3 goals: to introduce the mission to potential donors, to utilize volunteers to help revitalize the neighborhoods of the Mon Valley, and to build a funding stream for unrestricted dollars. Last year, 495 volunteers donated 3,870 hours in support of our projects in the Mon Valley. Our volunteers help with projects that range from direct service with the children, as you can see PNC here, to maintenance and construction projects such as working on our Kaboom community playground. They created a butterfly and vegetable garden at our 4 Kids Early Learning Center, and our volunteers built benches for Port Authority and WorkLink stops around the Mon Valley. Our staff includes our president and CEO, 2 dedicated WorkLink staff members, 7 administrative staff members, 27 teachers and staff at our 4 Kids Early Learning Center, as well as 6 teachers and staff members at our host site. Our board of directors has representatives and partners from the Mon Valley and Pittsburgh region, including PNC, Dollar Bank, Giant Eagle, Pitt, Carlo, CCAC, U.S. Steel, Rivers of Steel, and the Pittsburgh Symphony Orchestra. We're currently facing two large significant changes. The first being the federal transportation bill signed last July eliminated dedicated funding for work-related community transit. This means that the money supporting WorkLink will run out June 30th. We're currently working with local officials to find new state and local resources. Our next significant event is our President and CEO, Michelle Atkins, retires this summer. Our board of directors is currently interviewing candidates with a succession plan in place, and the anticipated start of our new CEO will be late May, early June. Our original project with PACE was to be a strategic plan. However, due to the significant events I just mentioned, we're now going to change that to a business plan. We know we need a long-term plan, but not knowing what's happening with our WorkLink funding, it's leaving us needing a business plan to analyze our finances, expansion, and our current programs. The impact of this project means that our board and the incoming CEO will have a better idea of the various options so that they can make appropriate management decisions. With the current CEO retiring, the incoming CEO will have alternative strategies for business models and alternative choices. So where we're at now is that the Hill Group has sent our proposal for the timeline with actions in their deliverables. The kickoff call is this coming Thursday, and our business plan will be completed by June 30th. The Hill Group will define strategy alternatives with their financial pro forma in order for the board and CEO to select an appropriate strategy. Our mission is to enable individuals and organizations in the Mon Valley to improve health, education, economic strength, and social vitality of their communities. And we thank PACE for providing us the support in order for us to continue fulfilling our mission.
Presentation with a disclaimer, but that's going to go out the window because to Peg's dismay, I rearranged the order of a slide or two. So my name is Trish Gadsden, and I am the Executive Director of Macedonia FACE. I have been the ED of FACE since September of 2010. It seems like only yesterday. We are located at the second floor of the Hill House Association on Center Avenue. We were founded in 1994 as a volunteer ministry of Macedonia Church. That ministry quickly grew to recognize that there was an expansive need of the community based on socioeconomic factors, and we shifted to become a social service agency. Our chairman of the board is Pastor Brian Edmonds, which was a significant leadership change for us in March of 2012. When Pastor Barr retired, who was our founder. Pastor Brian brings to us some energy and additional commitment to our clients. Macedonia FACE focuses its service provision within the Hill District, but serves all of Allegheny County, and we specifically emphasize areas that are disparately represented by African Americans. These include child welfare services, violence prevention, HIV/AIDS prevention, education services to school-aged children, and overall crisis and emergency support for people living below the poverty line. As stated previously, our services focus on these disparate rates. So African American children and families on a national level are overrepresented in child welfare. African Americans comprise nearly 13% of the population in this country, but nearly 50% of all people living with HIV are people who look like me. 40% of the population within the Hill District live below or at or below the poverty line. In terms of services that we offer, by the end of June, we will have served 220 children with family group decision making, over 100 youth in HIV prevention, and an assortment through bullying prevention. In the bullying prevention services, we are pleased to be funded by McCulley Ministries that allows us to provide community-based services to students of all ages as well as adults, and help them partner with help them partner with school districts. We also offer Safe Dates, which is an evidence-based curriculum that is offered to adolescents and older teens in school and youth settings to educate about partner violence. We offer HIV/AIDS prevention. For the past 2 years, our staff has been reaching out to youth and young adults who are at risk of contracting HIV by utilizing an evidence-based curriculum called Be Proud, Be Responsible. We were fortunate to be funded via the Jewish Healthcare Foundation, the fiduciary for the Pennsylvania State Department of Health, and the Pittsburgh Foundation. We have just recently received additional funding to continue this program through Mendel and Sylvia Solomon Charitable Trust, administered through PNC Charitable Trust. Effective July 1, Macedonia Face will be offering case management services to people living with HIV. This is a natural progression of our service as we continue prevention services. We also offer Lifeline services, which is emergency case management. And for the past 3 years, we have been providing services to people who are living below the poverty line on an emergency basis. Like all nonprofits, we face a budget cut. And so in order to make ends meet, we try to think out of the box and we bridge partnerships. One of the ways that we've been recently able to bridge a partnership is through a strategic alliance. And we learned a lot about that at a program that was offered through PACE that Sheila presented to our organizations. And so we've been fortunate to develop a strategic alliance with another nonprofit that offers mental health and drug and alcohol services. And as a result, we've been able to mutually refer clients to one another. In addition, in terms of our agency staff, in terms of staff and governance for our agency rather, we have 12 paid employees, 5 consultants, and 4 faithful volunteers that show up every Thursday. We are governed by a 12-member board who represents diverse provisions. This is our second year participating in a PACE capacity building grant, and as a result, myself and a fiscal manager has benefited from coaching through the Bear Center for Nonprofit Management. We're also in a process of assessing our brand and determining if it actually meets our needs, and we're looking at some IT needs. As a result of the services, we've been able to develop a dashboard, or the fiscal manager has been able to develop a dashboard that presents more comprehensive reports for our board. But most importantly, as a management team, we are more confident about the services that we've been able to provide. In terms of thinking of how PACE supports us, think in terms of Legos. We had all the pieces, we just weren't quite sure how to put it together. We built a foundation, and as a result, we can visualize the structure. Where we are right now is that we've developed a plan, we're receiving coaching, we've assessed our IT needs, and now we're looking at our brand strategy and marketing tools. And we are looking to be able to implement and unveil that later this summer. So thank you for your attention. Our mission is to encourage the development of healthy families.
Good afternoon. My name is Linda Baker. I'm the Vice President of the McKeesport Little Theater, and I am here literally on the fly. This is an original picture of where we started out. In 1960, McKeesport Little Theater was founded in McKeesport, always been located there, never wanted to move. We are located currently, on the next slide you'll probably see an upcoming picture of one of our early productions. There we go. This was an early production that was held originally there, and that is, I believe, Oliver. The original, I think that was the first production. First play I know was not Oliver, but it was the first musical that was conducted there. In 1972, the building that we were housed in was burnt down in the middle of a production, literally burnt down in the middle of a production. They were doing a production of Sound of Music. So, needless to say, show must go on. The next day, we found an alternative location in the community. Show went on, all new costumes, all new sound, everything had to be done overnight to be able to continue the production. But what it showed was the resilient spirit of wanting to maintain an arts organization in the Mon Valley. In 1974, the theater purchased a synagogue, former synagogue, on Corson Street, and that's where we are currently located and still there. And we moved in, refurbished the building from synagogue into the theater that it is today. I believe this is one of the early productions at our new location. This was of a production of Pippin, which I think is the next slide that you'll see. One of the things that McKeesport Little Theater has always been very involved in, proud of, is the development of educational opportunities in the arts for children. The Second Stage Players is the current name, but back in the day it was called just the Juniors. We draw students from all of the local communities around the Mon Valley, the McKeesport area, White Oak, West Mifflin, and have served that population consistently. Let's see, obviously South Pacific. This is the first year that McKeesport Little Theater has participated in the PACE Capacity Building Program, focusing on things like audience development, marketing, and developing compiled financial statements in order to reach broader sources of funding for arts and the arts education that we're providing in the area. Just 2 years ago we applied for RAD grant funding for the first time, and one of the things I can tell you is, having testified in front of the RAD board, our involvement with PACE, we talked about that in our RAD presentation, and there were several other community-based arts organizations that were very interested. New Horizon Theater was one of the ones that I spoke with directly, where we can show partnerships and share information with other arts organizations that are serving economically disadvantaged communities in which we are located in McKeesport. The other program I wanted to talk about in particular was our youth program. That's another picture of one of our earlier productions the youth involved in. Many of the students that participate would love to be able to afford to go to the Civic Light Opera Academy or Pittsburgh Musical Theater, which cost hundreds of dollars for students to attend. The educational program that we offer at McKeesport has an annual membership of $35. And I can tell you, for the most part, students that are struggling to meet that, it's provided without any cost to them to come. The students are there one night a week for training in everything from monologues to improvisation skills to students that are learning how to run a light board, how to do sound engineering for productions, so costuming, makeup, all the aspects of community theater where they have an opportunity to learn. This was last year's youth production of Camp Rock. It's always wonderful to be able to show what our students are learning, what they're doing, and giving them an opportunity and a place to perform in a location where we are pleased to stay in McKeesport and be a part of the vital community that's there. The marketing program and the audience development, we want to be able to draw more attendance into the theater for programs such as the Second Stage Players and our main stage productions from the local community. And our program that we're working on with Kate Prescott, who is our consultant that we're working with, is in the process of helping us do that. And this was our mission statement, and it says over 30 years. We have now been there over 50 years. Again, our main source of involvement is education, whether it's education of children or actors that are wanting to develop their skills in adult theater. This was our most recent youth production was The Little Mermaid. Some of our kids. Thank you.
Listen, I'm the executive director for the Pittsburgh AIDS Task Force. I'm going to be reading, which is something I don't usually like to do when I speak in front of people, but I wanted to keep up with all of this. And I know if I don't read it, we'll be way over. The Pittsburgh AIDS Task Force, commonly known as PATF, was founded 27 years ago by a group of dedicated individuals from Pittsburgh who realized that a response was needed to the high number of gay men returning and living in Pittsburgh who were dying from AIDS. In 1985, PATF became a 501c3 serving the 11-county area of southwestern Pennsylvania. The capacity of PATF to provide supportive care to individuals living with HIV and AIDS grew into an organized and well-trained case management staff. Early in the agency's development, the two-pronged mission was established to provide care and support to those living with HIV, as well as prevent the transmission of the virus. These are some of the early volunteers that were involved with the creation of PATF. It was truly a grassroots organization. And this is our logo. 5 years ago, PATF moved to a new, bright, and inviting location from a dingy and very depressing one, providing a significant boost for staff and clients. 4 years ago, PATF became a covered entity for the 340B pharmacy program. PATF has strong partnerships with Persad Center, the University of Pittsburgh Graduate School of Public Health, and Family Links. New leadership came to PATF in 2011 with the appointment of a new executive director, after the former director retired. Also in 2011, a new director of development, director of housing and client services, and director of community outreach was hired. I didn't fire all those people. And in 2012, a new director of prevention services was hired. That's our board president and me. This is our director of client services on the bottom. And this is us at Pride Parade. PATF serves over 600 clients annually. These clients are all living with HIV, and the majority are living 133% below the federal poverty level. 60% of our clients are African American, and another 67% are identified as either gay men or men who have sex with men. Our prevention programs reach a much larger population. We test over 2,000 people yearly for HIV, as well as distribute over 100,000 free condoms in safe sex kits. Our Speakers Bureau and volunteer outreach programs reach over 13,000 people with information about preventing the spread of HIV, as well as other sexually transmitted diseases. This is from our M2M program. I'm getting behind. PATF has a number of successful programs supporting individuals living with HIV, as well as programs to encourage the prevention of HIV transmission. With funding from HUD, PATF offers transitional as well as 3 scattered site permanent housing programs for homeless HIV individuals and families. Federal Ryan White funds, along with private donations and foundation funding, enable us to provide medical case management and emergency financial services, including assistance with rent, utilities, prescription and medical copays, as well as medical transportation and food bank services. We provide a free care fund for those who do not qualify for Ryan White funding. PATF programs to prevent the transmission of HIV include the Girlfriends, the Girl Talk programs, targeting African American women and teen girls, HIV and STD testing along with them. The M10 program provides HIV and substance abuse risk reduction interventions and HIV testing with men who have sex with men. PATF provides free HIV testing and counseling at 3 permanent locations, as well as bars and community events. We have a robust volunteer program, including the Ambassadors Program at the University of Pittsburgh, the Faith Initiative Fighting AIDS Inspires the Heart, Speakers Bureau, and community outreach programs. We are seeing a steady increase of intakes in our agency with people living with HIV for supportive services and medical case management for a number of reasons. The Affordable Care Act and the future of Ryan White funding is a key environmental change, presenting unique challenges to PATF to re-examine how we carry out our mission in a sustainable manner. The PATF Board of Directors is composed of 16 members, along with the Executive Committee, Finance, HR, and Development Committees. Management of the agency is comprised of a leadership team composed of the Directors of Finance and Administration, Development, Prevention, Community Outreach, and Information Technology, as well as the Executive Director. The Client Services and Housing Department consists of 7 full-time medical case managers, 1 part-time Client Services Administrative Aide, and an AmeriCorps member who coordinates the food bank. The Prevention Department includes 1 full-time HIV counselor and tester, 4 full-time prevention specialists, and 1 full-time outreach and resource specialist. The Development Department includes 1 full-time development associate and a full-time marketing and public relations coordinator. The IT department consists of 1 full-time data manager. Office administration and employee benefits is managed by the full-time office and benefits manager, and the coordination of volunteers is staffed by another AmeriCorps member. These are some of our staff persons. Our project with PACE has been to engage in an information gathering process prior to preparing for strategic planning. The information needed is related to changes brought about because of implementation of the Affordable Care Act and the National HIV strategy. The overall strategy is to develop a sustainable business plan for PATF. The assistance PACE has given PATF has provided the leverage and incentive to identify and interview numerous key informants as well as capable consultants to assist in the kind of research and planning needed to establish an effective strategic and operational plan. Navigating the unknown and often confusing aspects of the Affordable Care Act and how it will affect HIV service agencies continues to be a challenging endeavor. We've engaged in a second consulting firm to assist us in phase 1 and 2, and this process with PACE has been interesting and helpful and has given us an opportunity to look beyond our own expertise and build capacity to engage in new and innovative ways of thinking, such as how our board operates, new partners in information gathering, as well as encouragement to build our nonprofit into a center of excellence.
Program and Development Associate at Reading is Fundamental, or RIF, Pittsburgh. It's been great hearing about everybody's projects today, and I hope you'll enjoy learning a little bit about RIF as well. Founded in 1981, RIF Pittsburgh's mission is to provide children with the resources, motivation, and opportunities to develop a lifelong love of reading. We serve our city's most economically disadvantaged children and families, touching over 20,000 kids each year. Well, we've been serving the community for 32 years. 4 years ago, we underwent a significant transformation. We brought in new leadership, took on 2 new programs, and built a whole new team. We now have 5 staff members, 5 AmeriCorps members, and hundreds of volunteers. We emerged from this transformation armed with an arsenal of services that allows us to more effectively tackle the literacy challenges that our community faces and to give the children we serve the tools they need for future academic success. Did you know that studies have shown that in low-income communities, there's only 1 book available for every 300 children, like this slide represents? Studies have linked the number of books in the home with increased reading achievement and have shown that by simply increasing access to age-appropriate reading material, we can have a profound impact on the level of education a child can attain. And we combine that access with fun, motivational literacy activities and family involvement. We can spark a lifelong love of reading that may have otherwise gone untouched. I'll just go. Our programs operate in 130 sites.
There you are.
Oh, okay, now I'm way ahead of myself.
Take a breath.
All right.
It's a cute picture.
It's a really cute picture. Okay, our programs operate in 130 sites throughout the communities, including schools, community centers, daycares, public housing communities, and after-school programs. In the past few years, we've been focusing our efforts on the neighborhood of East Liberty, the Hill District, Homewood, the North Side, the South Side, and Wilkinsburg. And in the majority of our sites, between 80 and 100% of children are eligible for free and reduced lunch. Our oldest program, Books for Keeps, provides 64,000 books to more than 20,000 children each year. And children in this program participate in reading celebrations, where they read a story and participate in a fun activity, and then get a book to take home and keep. Our sites have between 3 and 5 reading celebrations each year. And in 2009, we piloted a Books for Keeps math and science program, which connects reading, math, and science together in a fun and meaningful way. By engaging students in hands-on math and science experiments connected to a story, which are often facilitated by a real scientist, we're building the foundations for academic success, exposing students to STEM career opportunities, allowing them to get their hands dirty and have a lot of fun. And our third program, Read to Your Family, works to incorporate reading into everyday life and provides incentives for students and families to read together at home. helping to add one more layer of reading motivation for children and families. Last year, students in this program read 12,500 books at home with their families. And in 2010, we took over our Everybody Wins program. Everybody Wins is a lunchtime literacy mentoring program that pairs elementary school students with volunteer mentors to share lunch and good books for an hour each week. This year we expanded the program, adding a second reading day at Weil in the Hill District and introducing the program into Faison and Homewood. And we're currently serving 170 students through this program. In 2010, we also took over our Storymobile, and these libraries on wheels take books, activities, and literacy resources to housing communities and daycares across our city. The visits are designed to promote reading and literacy activities, and in 2012, we introduced our second vehicle into service, and we've served 1,700 children and families since then. RIF Pittsburgh's goal is to ensure that all of our programs are fully integrated to maximize the impact of our resources. Our Storymobile leads our organizational efforts and has become the cornerstone of our organizational strategy. Our target Storymobile neighborhoods have become focus neighborhoods for our whole organization, and we're working to introduce as many of our programs as possible into sites in these communities. The Storymobile is a highly visible sign of our work in these communities, and the layering of multiple RIF programs kind of gives hands and feet to our efforts. This allows us to build the foundations for academic success by providing children with a comprehensive, holistic literacy experience that touches them over and over and over again, from 2 years of age well into their teens. As we continue to move forward, we'll also make it a priority to deepen collaboration with our partners, like the Center That Cares, educators, stakeholders, community residents, local organizations, to leverage our shared experience and resources to make meaningful impacts on the children we're all serving. For example, we're excited about a new partnership with the Saturday Light Brigade to create a story box that amplifies the voices of the youth that visit the Storymobile in Northview Heights. And in March, we celebrated Dr. Seuss Day and Read Across America with the Carnegie Library Saturday Light Brigade and second graders from Pittsburgh Allegheny, our outreach coordinators, who are all pictured here. As you can see, we're really excited. We got dressed up, and they loved engaging the children in story times, crafts, a book hunt, and skill-building literacy games. But in order to sustain our growth in programming and to ensure that we can continue to impact the children in our community for years to come, we saw the need to build up the capacity of our organization. Our strategic plan calls for establishing financial sustainability through revenue diversification, the strengthening of our board, and increased awareness of our organization and the importance of children's literacy. To establish financial sustainability, we've been working hard to build up our individual giving base with the goal of raising $85,000 annually by the end of 3 years, which is this upcoming May. Last year, we achieved our milestone with a goal of $65,000, and so far this year, we've raised over $70,000, so we're confident that we'll be successful. To do this, we've added 150 new donors this year, re-engaged lapsed donors, reduced our attrition rate, and developed more targeted donor communication strategies. We've continued to add strength to our board and have been working to develop and engage them fully in the fundraising process. Of note, this year, our board has made thank you and solicitation calls to donors and has been hosting cultivation events. And finally, we continue to focus on awareness and found some very special opportunities this year. Our national partner, Reading is Fundamental, Inc., launched a public service announcement last year asking people to stop and remember the profound role that books can play in a child's life. The campaign has been running nationally, and both television and radio ads have run locally. So, with the help of some of these new board members and the generosity of Lamar, we were successful in bringing this campaign to 20 billboards across our city, and we've been able to get some local magazine coverage as well. You'll find a third-page advertorial in this month's Pittsburgh Magazine and a half-page advertorial upcoming in May, and we think it's a really adorable campaign as well. So I just wanted to thank everybody for your time, and thank you to PACE for making all of this possible today, supporting our efforts over the past 3 years. Our participation in this program has really helped us to become a stronger organization and to better impact the children that we serve. If you have any questions, I'll be happy to talk to you afterwards.
Good afternoon, everybody. How are you? At Ward Home, we change lives. I am Blake McNally, Program Director, and teaching at-risk teens the skills they need to be successful as independent citizens of our communities is the core of our mission. With the hope of our philanthropic community, we teach skills for living and hope for life. In our programs, teens discover how to pursue an education and earn a degree, explore certification programs, and develop healthy personal interests, prepare for employment and learn job-ready skills, manage their health, safety, and well-being, and plan for the future. Our teens are beating the odds. We exceed the national statistics in that 80% of our teens have a part-time job or participate in community service. 90% graduate high school or get their GED, and 75% go on to a form of higher education. We believe education is the foundation for independence. We provide tutoring, mentoring, and enhanced programs to help our teens envision possibilities they may not have otherwise considered. Through educational, certification, or vocational programs, our teens prepare themselves for sustained independence. For our teens who go on to higher education, we assist them with filling out scholarships and college applications. We take them on college tours. We help them move into dorms. We build morale and confidence by sending them care packages and awarding scholarships to partially funded by our own staff. One of the biggest barriers to independence is obtaining affordable housing. We teach our teens how to find suitable housing and how to read and understand a lease. At Ward Home, we support teens in our independent living program by subsidizing their rent for the first 3 months and providing assistance with furniture needs and apartment essentials. 80% of our teens participate in community service or hold a part-time job. Some of our teens are already entrepreneurs. To enrich employment skills, we are now embarking on a new program that will give our teens real work experience and immediate supervisory feedback to enhance job retention skills. How do we develop teens for success? Success comes from our dedicated staff, tutors, mentors, and community partners who will work together to instill values, goals, passions, and skills to nurture the potential of each of our teens. Because Ward Home teens are the recipients of the generosity of mentors and volunteers, they have learned the importance of giving back to their communities. Some examples of our teen volunteer activities include participation in the High Mark Walk, preparing care packages for our troops, and serving meals to the homeless. We introduce opportunities to our teens that may not have otherwise experienced. These opportunities include VIP trips to Steelers training camps, photography classes, cooking classes, and college tours. All of these experiences open their eyes to a new world that may spark a passion or create a career interest. For over 108 years, Ward Home has met the needs of those we serve. Starting as a day nursery on the north side to our current independent living programs. Over 10 decades of experience in working with foster youth has given us unparalleled expertise to transition teens into successful adulthood. To ensure we continue to deliver the highest quality programs, we are using our PACE grant to develop an outcomes evaluation program. This program will help us track our successes and evaluate our program delivery to ensure that our teens are receiving the highest quality of care for the most opportunities of success. Our dedicated and experienced staff help our teens navigate the tricky waters of academia, understand the importance of personal fiscal responsibilities, determine achievable goals, careers, and create networks of friendship and support. It's through compassionate and nurturing relationships that our teens will realize their true potential. Our impact reaches over 160 teens every year. Our teens come from disadvantaged and trauma-induced backgrounds, requiring us to have a special understanding of all their needs. The majority of our teens reside in apartment-style living, which encourages them to put to use the skills they are taught on a daily basis. Helping teens realize their potential requires the partnerships with foundations, corporations, and individuals. We get involved in a meaningful way to generously support our mission. These partnerships provide us volunteer services, grants, and donations in order to sustain program excellence. To help Ward Home achieve our governance and fundraising strategic plan goals, we have engaged boards work to provide training which will enhance and grow our board of directors. We have also hired a new director of development to expand and attract new donor relations and increase community awareness of our mission. Outcome evaluation will help us improve our service delivery goals and to determine future programming needs. A recent alumni, Ivory Bennett, recently received proclamation from the governor's office recognizing her overall achievements. PACE funding will ensure that all our teens reach a similar level of success. Our enrichment program includes a curriculum for teen moms to teach them how to make informed decisions for the well-being and the well-being of their children. Impacting these teens is critical to their future and their children's future. Our PACE project will help us with the evaluation and quality improvement efforts in all of our programs. The outcome evaluation project will streamline our process to help our staff focus on our mission. The close relationships our staff builds with our teens enhance the teaching of essential life skills. We use technology to enable our staff to have more flexibility in when and how they teach their lessons. At Ward Home, our programs help our teens become tomorrow's good citizens. They will be our future chefs, nurses, social workers, and electricians. They will be our children's spouses, neighbors, and friends. The work we are doing at Ward Home creates skills for living and hope for life. And we want to thank PACE for their support of our mission.
Well, now we can give an enormous round of applause. Myself, my name is Peg Fiedler, and I'm the program manager for our intensive services capacity building program. And our 11 groups who are with us today have worked very, very hard in putting together this presentation. And I certainly want to thank all of them for all of their hard work. Justy Huff, who is our intern, she helped me in this process. Of course, Tina, who is kind of jack of all trades for our office. She's always right next to my side helping me with this event, and especially to Catherine Heffernan with Reading is Fundamental. You would stand, Catherine, you have to, because she's the one who helped put this entire presentation together with me on Friday, getting the timing perfect, and she has just been great the last 2 years in working with some of our new groups coming on board, and we're just extremely grateful. One of the great things of this program is not only the grants that we provide to do capacity building, but really the relationships that happen amongst the groups that are each year come together as a cohort.